Hi, I'm Brittany Jackson, and I'm in term 2, and I'm going to be doing NG tube insertion and irrigation. I'm going to start by reading my doctor's orders, my mark, and I'm going to see that he's ordered an NG tube, and I'm going to figure out if he's ordered it for a read, if he's ordered it for suction or for tube feeding. And then I'm going to gather all my supplies and head into my patient's room. And I'm going to introduce myself and check the patient's name and date of birth. I'm going to make sure to perform hand hygiene when I enter the room. And I'm going to explain the procedure to the patient, tell them that we're going to be doing an NG tube, why we're doing it. It's going to go down your nose into your stomach. And I'm going to inspect their nares. Okay, no occlusions or deviated septum. I'm going to occlude one nair, sniff in and out. Same with the other side. Right. And I'm going to choose the right nair. And now I'm going to put on my gloves. And I'm going to measure the length of my NG tube. I'm going to do that by the tip of the nose, around the ear, to the xiphoid process. And I'm going to tape that. Okay. And I'm going to make sure to cover the patient and put the bed in high Fowlers. Okay. And I'm going to lube the tube at least 4 inches. And then I'm going to insert the tube into the right nair and have the patient lean back on the pillow. I'm going to insert it till it's into the back of the throat. And I'm going to look at the back of the throat to make sure there's no coiling. And there's not. I'm then going to advance the tube by asking the patient to swallow. And I'm going to tell them to put their head chin to chest. Each time they swallow, I can advance a little bit. They could also take sips of water, and if they're having any difficulty, I can take a little break and then restart again, doing the same thing. I'm going to advance until I get to my tape. Okay, and then I'm going to tape this temporarily to the patient's cheek, and I'm going to pull up 30 mils of air and insert the air embolus while I listen to the left epigastric area to make sure that it's in the right place. Now I heard gurgling sounds, so I think that it's in the right place. I could also check the placement by asking the patient to speak. I could ask the doctor to order a chest x-ray. I could measure the tubing later on when I come back in. I could inspect the back of the throat. And now I'm going to secure the tube to the nose because I've checked for placement. Okay, now that that's secure, and I would put the patient on suction, make them comfortable again, and I would perform hand hygiene, take off my gloves, and I'd make sure to document the time of the insertion, the patient's response, the NG tube length, size, and type, the color and consistency of any drainage, any instructions I gave, and the pH if I had tested the pH as well. I'm now going to go back in the room for irrigation. I would perform hand hygiene and put on new gloves. I am going to take the patient off of suction. And take out 30 mils of gastric secretions. As I reintroduce it, I'm going to listen for those gurgling sounds again. Okay, that's good. And now I'm going to pull up 30 mils of normal saline. I could also use tap water. And I'm going to insert that into the tube. And then I'm going to aspirate it back out. Okay. Could check the pH of this too if I wanted to check for placement. I would then attach the patient back to suction, make them comfortable again, and I would perform hand hygiene, take off my gloves. I would document the type and the amount of the irrigation solution, the difference in the volume that I gave the patient, and then what I got back. So if I got something different than 30 mils back, I would make sure to document that. I would document the characteristics of the return solution, any difficulty with irrigation, the client's response, and any teaching that I gave.